Welcome back to another episode of your show, The View. Thank you for tuning in every other week. For you faithful watchers, I appreciate joining us and being here with us and watching the show. A lot of production goes into making the show for you all, and so thank you for joining us. Don't try to adjust your screen. It is me. It's Edgar Solis. I just have some hair on my face, so it's nothing to do with your screen or your TV or wherever you're watching us. But good morning, good afternoon, or good evening, maybe good night, depending on when you're watching this show. And I'm pleased to have Christian Carranza, the IT operations manager. How are things going?
Great. Very busy. A lot of fun stuff happening. A lot of improvements that we'll talk about soon. But very excited.
All right. So before we get to Christian's updates, let's start with some announcements. Back to school event. A lot of what we do goes beyond our four walls of our hospital and our clinics. We partner with a lot of community-based organizations. They donate a lot of the supplies that we offer to the community, where if it's produce, or in this case, in the back to school event, there were some donations for backpacks, and we coordinated with the community-based organizations to deliver these necessities to the children in our community. We had 165 students that received backpacks. We want to thank Latora Green, the founder of the Valley of Change, for donating these backpacks, and school supplies. So these backpacks were full of school supplies. Are your kids back to school yet?
Soon. We were fortunate to participate that day, and to see the amount of people supporting and all the love for this event was great.
Yeah, and the Valley of Change is a great partner. They've been partnering with us for the past 3 years, and so Valley of Change, our partnership, is invaluable. We look forward to future years and continuing to do this great work. All of you medical staff also participated, and they generously contributed to school supplies. So thank you to all the staff that donated supplies, or also donated their time in assisting that event. Kevin, Juan, and Abraham from Sodexo for helping set up the event. Thank you so much. Facilities team for providing those canopies, and Sandra Alina, Sandra Beltran, Lucia Soto for volunteering their time outside of work to ensure that the event ran smoothly. And because of everyone's efforts, families left not only with backpacks, books, and resources, but also feeling the support and care from the All of You family and our community partners. Please stay tuned to the end of the episode. You will see a little video of some of the pictures from the back to school event. So it's an awesome event. All right, so wireless access. Everybody, whenever anyone comes to my house, they're like, Edgar, what's the they can't live with that
with the Wi-Fi password.
Wi-Fi password, right? That's one thing to have it at home, but it's critical to have access to Wi-Fi for the work that we do here at the medical center. And Christian, you're gonna give us an update on what we're doing to modernize and update that, right? To make it a smoother connection.
Yeah, of course. As you said, currently our Wi-Fi devices are about 10 years old, which in technology, obviously, that's ancient.
That's really old.
So this is not just an All of You initiative, but a DHS initiative to upgrade our wireless infrastructure, to modernize it, make sure we have better performance. It will definitely help with some of those dead spots that we have. And of course, as we modernize things, we are relying on more wireless devices like tablets, iPads, phones. So the new equipment will definitely help out with the performance and also future-proof. There's actually fun other bells and whistles that it has for the future purpose. So this is a great effort across DHS to make sure that all our campuses have the latest Wi-Fi access.
So when will this work begin?
So we actually already started. All the external buildings, they've already been upgraded. That was one of our main efforts, is to test everything out, make sure that everything works when we're replacing a device, for everything to transition and switch over to the next available. So successfully, we've implemented that across every external. Now, starting the 25th of August, we will be going inside the hospital to upgrade the main APs inside the hospital. So that you'll start noticing the difference, very soon inside the hospital.
All right. So great work. Thank you for that. And I know they came into my office, and I'm sure they're coming into different desktops to change out. I hear from upgrading from Windows 10 to 11.
Yes.
Why is that important?
Well, Windows 11, of course.
Because I still use Windows 97 at home.
Windows 97 was great, by the way.
I don't know.
So Windows 11 is the new and latest operating system, which focuses a lot on security. And of course, nowadays, security is one of the most important elements of technology. Additionally, so for the next few months, you'll see us come across either replacing computers, upgrading storage. There's different ways of upgrading it. And so we have a very big effort to meet certain deadlines. So it would really help as we're coming in to the areas. We'll send out notifications to clear out some of your personal items from your desk and give our techs easy access to that computer. That way we can minimize the downtime in and out. We replace your computer with a nice, faster unit. And I think that's the whole point of this.
Yeah, faster is always better. I like working on a computer that's ultra fast.
Yeah,
has plenty of space to be able to do that. And RAM, right? RAM is up.
Yeah, that's part of the performance. But of course, ultimately, it's all about, can we perform our jobs better, faster, more efficient?
Absolutely.
That's what the whole intent of this project is.
All right, awesome. So if you have a desktop, where they'll be coming around soon, they started to do the switch out already. Right?
Yeah, so we started that as well. So you will get notifications when we're coming to your area. We'll let you know. That way you're prepared. There will be some minimal downtime, but we'll minimize it as much as we can, and we'll work together to make sure it's a seamless upgrade.
All right, awesome. All right, so we are continuing our fundraising efforts for the American Heart Association. Don't forget that the Heart and Stroke Walk will happen on Saturday, September 20th at 8 a.m. at the Rose Bowl. If you're interested in attending, please RSVP Brenda Yanes. We have all of you Medical Center branded t-shirts. This is an awesome design. You'll probably see it here when they put it up here. It's an awesome shirt. These can be purchased at the hospital admin, in hospital admin, room 2C155. I believe they are $25, correct? From producers are nodding their heads. So yes, $25 that you can wear to show your pride and who you are representing during this Heart Walk. I will be there, so I hope to see you there on Saturday, September 20th at 8 a.m. All right. And we are moving forward with the winner of the trivia of the week. Now, I know that we would always give one of my gift cards out to the winners. I ran out of gift cards. You guys all answered all the questions correctly. Thank you for participating. I am out of gift cards, but we will be awarding the correct answers. The folks that answered the first to submit their answer correctly will be awarded an Olive You branded t-shirt, the same shirts that we will be wearing at the Rose Bowl on September 20th. But last week's trivia question was, which organization launched the Baby Friendly Hospital Initiative to support breastfeeding? We are a baby friendly hospital. We do have that designation. But who started that organization?
Who?
The WHO.
Yeah.
That's right. The World Health Organization started this. They launched the Baby Friendly Hospital Initiative to support not only breastfeeding, but many other positive clinical processes to support well-being for the babies that we deliver here at the medical center. So the t-shirt winner for this week is Lucero Lopez Flores, intermediate clerk with Patient Financial Services. Congratulations. Come on over to administration. Let them know you answered the question correctly, and you are the winner, and you will be given an Olive You shirt. All right, and Christian, you're going to help us with the new trivia question.
All right. So, what innovative facility was introduced in 2024 as part of OVMC's expansion to support mental health services?
So there are these buildings that are around campus that are not necessarily part of the medical center, but they help support the mission that we try to provide. And there's buildings around here But what are those buildings? What do they do? That's the answer that we're looking for. Don't forget to hit the submit it through the feedback button. First correct answer will win a t-shirt. All right, on to shout outs. We have tons of great catches from Wei Nguyen, Gina Lee, Lap Woon Kyung, pharmacists, Isabel Arambulo. All these folks identified a potential medication error either through the ordering process or in the pharmacy in terms of prescription fulfillment. So thank you very much for supporting patient safety, for all of you, for being very cognizant of how identifying discrepancies with our ordering system. But thank you very much. We could have potentially prevented a medication error. So thank you so much for that.
Having that awareness is key. So that's a great catch.
Yeah, and there's a shout out for Tanga.
That's right. So Tanga Thompson, I'll read it out. It says, I'm grateful to work with a manager who leads with integrity, compassion, and has a strong commitment to patient care and safety. She listens openly, creating a space where everyone feels heard, supported, and empowered. Under her leadership, I've grown both as a CNA and as a person, and her encouragement has inspired me to continue my education and expand my knowledge in the medical field. That's a great shout out.
Yeah, great shout out. Congratulations, Tanga. Tanga was also the recipient of the monthly Above and Beyond Award. So congratulations, Tanga. That shout out came from Manny Novello. Thank you, Manny, for submitting that for Tanga. All right, we, as we all know, we conduct executive rounds. If we haven't been to your department, we will be coming soon. As you know, there's tons of departments that we have here at the medical center, and we're going through and visiting each one. Last week, we visited the Human Resources Department, and they're an on-site human resources, and they ensure that all workforce members meet onboarding requirements before beginning their assignments. They also help support workforce members, both county and non-county, by providing guidance and information on a wide range of human resource topics, including payroll, protected leaves, disability management, performance management, and so on and so forth. Many of you have had interactions with human resources. One thing that I got from that department was there's a lot of folks that believe in the mission and help support each other within that department. It was really cool to see how they treat each other like a family. It's a very close-knit department. And I haven't forgotten that they make like the awesome salsa, the pico de gallo, right?
Pico de gallo, yeah, as they said. Yes.
Pico de gallo. And, don't forget to invite me when you guys make that. I love pico de gallo. I love chips. And Christian, I think we should be invited to that as well.
Absolutely. I do want to add, out of all the different HR departments that I had the pleasure to work with, they were extremely friendly, how their interactions between each other and how they were very, grateful hosting us. And so it was such a great sight to see our on-site HR team. So
yeah, it's important. I mean, HR typically, new employees, their first interaction with all of you is with HR staff, and HR staff set the tone of what we expect and what the expectation is, and what is the vibe, as people, the young folks call it. What is the vibe that we have here at all of you? And we're friendly and we're respectful, we're helpful, and thank you for setting that tone, HR folks. We also visited the infection control team. Many of you know the infection control and prevention department here at all of you, and they're the folks that oh, here they come. They're going to watch me to make sure I wash your hands. Or they're here, they're going to tell me I need to remove that Foley catheter. But they do much more than that. Not only do they do this to ensure patient safety and ensure staff safety, but they also help in keeping patients safe by reducing healthcare-acquired infections and maintaining compliance with regulatory standards. And it goes just beyond direct patient care. They're also involved in construction projects. They also ensure that the construction projects are meeting their standards to ensure that the patients in the vicinity and the staff in the vicinity remain safe as they're doing this construction. They're like the only department that can put a stop to to construction.
To construction.
Next time you're walking around and you see a construction project, there's a little document called an ICRA. That's an infection control risk assessment document, and that's like their permit to be able to do work inside. So, so they do, not just surveillance of infections, they also do healthcare-acquired infection identification. They help us with transmission-based precautions and oversight of that, compliance monitoring. They round in the units. They also report to the state and the federal government, to CMS through the NHSN program. These are all lots of requirements, and we know that they were very instrumental in something that happened back in 2020. If you guys remember the COVID pandemic. Yeah, it's such a blur, right? 2020 was just like yesterday. But yeah, an outbreak response, whether it's a tuberculosis or a flu or COVID or a diarrheal infection, they're there to help us out to ensure that we maintain and control that outbreak. So thank you for your clinical expertise. Your data-driven practices, all the infection preventionists. Thank you for keeping us safe and keeping our patients safe. All right, feedback. We had a lot of feedback. I appreciate every time when I get the report of all the feedback we receive. It always makes me happy when we have more than just one. Last week we had a lot of feedback, and we'll go through them here. Our primary care clinics are usually the first impression for meeting patients. Could we explore opportunities to refresh the space with a more modern and welcoming look? Absolutely. As I've mentioned in the past, I don't know if you've been through the first floor lobby. Have you seen?
Yeah.
Have you walked through?
I've walked.
Have you seen? Did you experience the changes?
Yes, the painting.
Tell me what the vibe that you felt walking through.
Well, it's definitely an improvement. I think the color, the painting aspect, keeping everything a certain clean color, I think it's good. I know we're working on upgrading the technology, some of the TVs to, better, populate all the information that people need. So yeah, it's definitely a big effort to beautify not only just a lobby, but, the entire hospital.
It's a big effort, and it's also a big monetary investment in some circumstances. And so, as we all know, we are facing challenges with our budget and a crisis. So we have to be very careful on how we invest into these. But something as simple as paint can go a very long way in changing the vibe of the room, the look of the room, make it look more modern. Whoever submitted this information, if you have a specific clinic that you feel we should start with, I'll take this information back to the primary care clinic triad team, so they can start giving us ideas on how we can refresh the space or modernize the look. And something as simple as paint can do that. All right. You want to help us with number 2?
Sure, yeah. So since hospitals patients are screened by security, would it be possible to consider adding similar security support at the primary care clinics located outside the hospital?
Yeah, that's something that we can definitely look at. Our contract, the way it works is our contract specifies the number of security guards that we have at any given point. We'd have to do an analysis with, again, the primary care clinic triad team on where they feel that we might want to prioritize, what areas we want to prioritize for this, but it's something definitely that we can consider. Would it be possible to consider creating a department or process to review CNA documentation for accuracy? I think this would help strengthen patient care and safety. Actually, there is a documentation. I know nursing, and nursing can speak a little bit more specifically to this, but nursing does have a quality department that does reviews of the documentation, not only for registered nurse accuracy, LPN accuracy, but also CNA accuracy, and it involves all of nursing and ensuring that we have a high level of quality in terms of our documentation. Documentation is such an important thing. CNAs play a very important role in the delivery of care. So absolutely, if there's any ideas that we can help support you all CNAs, either in training or even in technology to make it a bit easier for you all, let us know. We're open to your feedback, but absolutely, nursing does have a quality assurance department that looks specifically into this.
Yeah, I mean, when it comes to technology, we could definitely, set up a meeting, see if there's anything that we can help streamline with the process and just get things a little bit smoother.
Yeah. There's also a suggestion, could we explore implementing a dress code to support a professional and unified appearance for staff? But we do have a dress code. There is a policy that does specify that, it has to be clean and neat and professional. There's also safety requirements in terms of the footwear that we use. There's even a requirement for folks that provide direct patient care and the use of artificial nails. So there is a dress code. I invite you to look into our SharePoint where we have all of our policies. And if you search for dress code, you'll find that policy. Okay. Well, we understand the hiring freeze and limitations on registry staff. How are any registry employees being trained? Ensuring strong onboarding could help maintain patient safety and consistency of care. You're absolutely right. I think registry staff, when they're onboarded here, it is important to let them know, not only determine are they trained, do they have the necessary competency to be able to provide the care at the standard that we expect our staff to do. And absolutely, I know that all registry employees do go through a training process. They're hired on as an employee would. They go through the same onboarding process. And once they do the onboarding process with HR, depending on where the registry folks are working, they go through a very department-specific training, again, to train them to our systems, our equipment, but also to assess their competency if they're competent to provide that care for us. And there's also a technology, with the systems that we use in the software.
There's training depending on what software, what systems and applications you're using. So there is a lot of that as well. And like I said earlier, if there is anything that we can help in the process, we're more than glad to have a look.
Yep. All right, number 5. Some cars have been parking parallel along the hillside across the education building in a non-designated area, which can make it difficult to pass through. Could we explore possible solutions for parking management in this area? Yes, parking management is one of those things that's just difficult to solve. Unless we had, endless amounts of money and we started building, multi-level parking structures that would solve a lot of this. But, and I don't think that's a reality for us at the moment. However, there are requirements that we ensure that we keep fire lanes open. And as you know, we're in fire season. It's actually really hot right now, and our fire risk level is elevated. And so it's very important that we all abide by the parking rules and park in designated areas. The reason why these exist is to ensure that safety cars, fire engines, ambulances have the space to get through in the case of an emergency. So it is very important that we all park in designated areas. I know that parking is kind of a pain around here. It's very difficult, right? We just recently opened up a space that belonged to a contractor. Well, we offered it to a contractor, and we were using it for construction purposes. We opened that up to all staff. We're looking at different ways to ensure that we have sufficient parking. But if you run the risk of getting towed and cited if you're not parked in a designated spot, especially if you're blocking a fire lane or an emergency lane. So please just park in designated areas, avoid a tow, avoid being cited by the sheriff's department. So I appreciate your support and your cooperation. Thank you so much. All right. Any last thoughts, Christian? I mean, anything that you're looking forward to? We're ending summer. Fall is going to begin. I'm looking forward to all the fall food, starting with the candy on Halloween and then moving on to November, Turkey Day, and the tamales for Christmas. I can't wait. But we have to live in the moment, and I appreciate today.
Halloween too.
Halloween. Do you dress up for Halloween?
I do a little bit. My daughter, that's her birthday's around that time, so that's her favorite holiday. So
Yeah.
it's the only day that we could act like kids, really.
Yeah, my kids don't let me get away with it. So yeah, they always try to do something with me. Like one time, my son was a minion, and I had to dress up as Groot.
Oh,
So that was fun walking around with the an artificial nose and everything. But yeah, please send us your thoughts, your feedback button. If there's a topic you would like to discuss, if there's a department you want to be a guest here and highlight, Let us know. Your input helps us improve. It ensures that we're meeting your needs and also things that you want to hear and you want to learn about. Keep the ideas and questions coming in. We are listening. We truly value your voice. We want to thank you for tuning in. Thank you, Christian, for joining me and providing those important updates. Follow us on Instagram. We're going to start posting a lot more on Instagram. We were focusing really a lot of the events that we're having on here, but you will see a lot more posts on our @UCLA on Instagram. Stay updated on the latest news and events there. Continue to watch the show. The obligatory statement is smash the bell, drop a like, hit that subscribe button. Let us know how we're doing in the comments as well. So thank you for tuning in. Please be safe, help each other, and most of all, be kind. And we will see you in 2 weeks.